Ear, nose, and throat specialists have a seemingly specific title. However, they work with a not-so-specific spectrum of cases from patients of all ages.
We see a lot of children, and their issues tend to be enlarged tonsils, recurring throat infections, recurring tonsillitis. And goes along with that is enlarged adenoids, recurring adenoid infections with tonsillitis, and also adenoids with enlarged adenoids, they can contribute to recurring ear infections.
Lisa Jacobson, an otolaryngologist at Cadillac ENT, says ear infections, which are rather common among children, can often be taken care of by antibiotics. However, in some cases where the ear infections are reoccurring, it could be because the antibiotics aren't actually getting to the root of the issue. Some cases require the child to have tubes put in as a more long-term fix.
With recurring infections, the frequency of their infections is very important. How often they're occurring and the duration of time in between infections, and the infection doesn't go away. If there's persistent fluid within the middle ear, are all reasons why we put tubes in. Some kids have infections during the winter months, and 4 months out of the year they're getting on antibiotics, one after the other. Some kids, it's more of 3 or more infections in a year, and they're spaced out through the year. So we look at there's criteria set apart for placement of tubes and when that occurs and how frequently that occurs in each child may be a little bit different, but those are all reasons why we put tubes in.
Surgery may seem like a drastic measure. However, Dr. Jacobson says putting in tubes is actually a rather simple procedure with many benefits.
Tubes are a little device to keep the tympanic membrane or eardrums open and ventilate the middle ear. So we call those ventilation tubes or PE tubes. Pressure equalization tubes is the PE, what the PE and the E stand for. And those kids have recurring infections and they respond well to the ventilation tubes. They the tubes will last for about a year, sometimes up to a year and a half in the ears, and the eardrums will simply push those tubes out gradually over time. So it's not something we have to go back to take the tubes back out after we place the tubes.
Without fixing the problem at its core by inserting the tubes, ear infections will just continue to arise.
The reason we place tubes in the new tympanic membrane is to alleviate the problem with the eustachian tube. The eustachian tube is a cartilaginous tube that two muscles pull on that, open that up. If that's not functional, it's very common to have infants that have that problem. If the eustachian tube doesn't open and close well, then they end up with middle ear effusions or middle ear fluid. The fluid can easily get infected, bacteria comes up through the nose, can infect that middle ear. So that leads to recurring infections. So we treat that with antibiotics, but we don't really treat the problem, which is the eustachian tube dysfunction, we call that. That eustachian tube is either short, it's horizontal, it's blocked by adenoids, it doesn't open and close properly.
Enlarged adenoids and tonsillitis are also common cases among the children who visit ENT specialists.
There's lots and lots of kids out there that require tonsillectomy. And tonsillectomy and adenoidectomy is very common in kids. They do well with it, much better than adults tend to do with taking tonsils and adenoids out. So indications for taking tonsils is the enlarged tonsil, the kids that are snoring a lot at night, the kids that have even obstructive sleep apnea, kids that are restless during the day, they don't concentrate well, they're tired from not sleeping well at night. Kids that are big mouth breathers, they chew loudly. Your parents are always telling them, you need to close your mouth. Or they can't get air in while they're chewing and swallowing, then that tends to indicate that the adenoids are big. Tonsils are big. If they have swallowing difficulties, those are indications that the tonsils may be enlarged and we may need to address them and take them out. The other indications are with infections. The kid that's always getting sick, always has a runny nose, always has a cough, sore throats, upper respiratory tract infections. Those that come in a recurring pattern are reasons to get your child evaluated for possible removal of tonsil and adenoids.
Dr. Jacobson says that treatment is actually easier for children than for adults.
It's much easier on the child. The surgery is easier in childhood than it is if it creeps into adulthood. I've seen lots of children that have quite enlarged tonsils. They've had it for a long time. They didn't have a lot of infections, so the parents weren't aware that maybe this was an issue. They get to be an adult, they start having more infections, and their tonsils are extremely large, and they could have been taken out at an earlier age, and will make a big difference in their recovery as an adult recovering from tonsillectomy versus in their childhood.
Knowing the symptoms can help parents get their child treatment early on, and that can make a world of a difference.
Some of those subtle symptoms may have been overlooked. Their difficulty sleeping, how they perform at school. Is there issues with attention? That seems to be an important topic that we're dealing with our kids.
So, if your child's facing recurring ear infections, difficulty sleeping, or suffering from any other ear, nose, or throat-related symptoms, it's worth bringing them into a doctor's office early on, because the earlier the treatment, the better.
They can always come in here and we can evaluate and give them an opinion if we think those tonsils are enlarged and contributing to the symptoms that they're having.
With My News 26, I'm Kayla Kiley.